Healthcare. It's a behemoth, isn't it? Just so many moving parts, so many lives impacted.
It really is complex.
And what's the sort of invisible hand guiding it towards, better outcomes?
Well, a lot of it comes down to effective leadership, especially when we're talking quality.
Exactly. So today, we're diving deep into what that actually entails. We've sifted through the latest research, unpacked some crucial regulations.
Yeah, the idea is simple, really.
Right, to give you the essential understanding of leadership's role in healthcare quality, just cutting through all the noise.
Exactly. Think of this as your shortcut, your way to grasp how these organizations really strive for excellence.
Okay.
We're looking at the foundational ways quality gets embedded, the rules that, keep everyone on track.
The standards.
Right. And the individuals who champion improvement, plus the kind of culture that makes it all stick.
So, grasping the core drivers. Okay, so if we're going to unpack this, where do we even begin? How does leadership actually influence quality management?
Well, a natural starting point is the core process itself. How leaders integrate quality right into the organization's fundamental operations.
Yeah.
Our sources really stress that quality can't be some separate thing. It has to be woven into the very fabric of the strategy.
Right, like the thread in the tapestry, you said.
Exactly.
No.
Not some pet project tucked away in a corner office. It's got to be central.
Got it. And it sounds like data is the fuel that powers this integration.
Precisely. The research highlights some pretty significant advancements here. We're talking about using data-driven insights to really pinpoint where performance is falling short.
And then focus efforts.
Yes, focus efforts where they'll have the biggest impact. Things like predictive modeling, real-time dashboards, they give leaders a much more dynamic view.
That makes sense. You can't fix what you can't see, right? And these tools offer that crucial visibility. But it's not just about the numbers on a screen, is it? The people actually doing the quality work, they need support too.
Oh, absolutely. Effective leadership recognizes that. It's vital to educate and empower the teams involved.
So, training programs.
Robust training programs, yes,
Yeah.
covering assessment techniques, performance improvement methods, and crucially, facilitation.
Facilitation, like bridging gaps.
Exactly. Acting as a bridge between the leadership's vision and what the data analysts are finding, ensuring everyone's on the same page.
Okay.
And there's even exciting stuff happening with, like, VR training modules.
VR training for quality assessment. That sounds interesting, like a flight simulator for healthcare improvement.
Kind of, yeah.
What are the challenges there? Costs, realism.
Yeah, adoption costs are a factor, and making sure the scenarios are realistic enough. But the potential for engagement, for effective training, it's significant.
Okay, so beyond training, how does leadership foster that teamwork piece on quality initiatives?
Well, facilitating collaboration across all levels is just essential.
And data helps here too.
Definitely. Not just finding weaknesses, but also highlighting strengths. This lets leaders drive improvements through, properly interdisciplinary teams.
Gotcha.
Our sources point to collaborative platforms, things like integrated care systems. Epic's Cosmos is an example that allow for real-time data sharing and coordination.
So everyone's working from the same quality blueprint, basically, breaking down silos.
Precisely. Using data as that common language. Now, of course, healthcare operates within a framework of rules.
Right, the regulations. What are the big ones leaders need to know?
Well, the CMS conditions of participation, the COPs, they're fundamental. They really lay out the expectations.
Okay, let's break those down a bit.
Sure. First, there's 482.21. That's all about the Quality Assessment and Performance Improvement Program, or QAPI.
QAPI.
And it's not just having a program on paper. It demands a data-driven approach involving every department and laser-focused on improving outcomes and reducing errors.
And there are updates.
Yeah, the 2024 CMS updates are really emphasizing patient-reported outcomes now, PROs.
So bringing the patient's actual experience right into the quality equation, that's significant.
It is. It makes the patient voice much more central.
Okay. What other parts of the COPS are key for leaders?
Well, Section 482.21c gets into the specifics of what QAPI programs need to do.
Like tracking errors.
Exactly. Mandating that hospitals track and rigorously analyze medical errors, adverse events, and crucially, implement preventive actions and feedback loops.
And AI is playing a role here.
Increasingly, yes. AI-powered safety systems can now help detect potential errors in real time. Think of it like an early warning system.
An AI safety net. Wow. Okay. And what about the very top, the executives?
That's 482.21e, executive responsibilities. It holds the governing body, medical staff, administration, accountable for setting clear expectations on safety and quality.
So accountability is key.
Absolutely. And also recent Joint Commission standards from 2023, they highlight the need for leaders to foster psychological safety.
Psychological safety,
Meaning creating an environment where staff feel safe to raise concerns, report errors, without fear of blame or punishment.
which is vital for learning and improvement, right? If people are afraid, problems get hidden.
Precisely. It's about building trust, transparency. Learning from mistakes becomes an opportunity, not something to hide.
Okay, so it's clear these regulations aren't just checkboxes. They demand deep, active leadership involvement backed by data and open communication.
Couldn't have said it better.
Right. So let's pivot now to the individuals themselves, the quality leaders. What does an effective one look like today?
That's a great question. The titles might vary, chief quality officer, quality director, whatever,
Yeah.
but their fundamental job is the same. Oversee quality management, utilization management, risk management,
Right.
keep an eye on regulations and the organization's strategic goals.
Okay, that's the job description, but what about the traits? What makes them successful in this complex space?
Well, at their core, they're deeply customer-centric,
Right.
patient-centric, really. Understanding patient needs and experiences, using survey data, that kind of thing.
Okay, patient focus first. What else?
We're empowering leaders. Think servant leadership, prioritizing the team's growth and needs. They also have this relentless focus on improvement, using methods like PDSA cycles constantly.
Plan to Study Act.
Right. And they're prevention-oriented, using predictive analytics to get ahead of risks, not just react.
We're proactive, not reactive. Got it. What else defines them?
Collaboration is huge. They foster that teamwork across disciplines, often using digital platforms to help. They act as coaches, using strengths-based approaches.
Developing their people.
Exactly. They're skilled at learning from problems' root cause analysis, sometimes with AI helping out. They're exceptional communicators, very transparent, using various tools.
And fundamentally committed.
Absolutely. An unwavering commitment to quality. They model that mindset, often using leadership dashboards to keep track and show progress.
It sounds like a really demanding, multifaceted role. Requires technical skills, people skills, strategic vision.
It really does. And their influence goes beyond just internal stuff, too.
How so?
Well, they pay attention to selecting suppliers and vendors based on quality, maybe using things like blockchain for credentialing. They ensure quality efforts get the resources they need using cost of quality
That
models.
makes sense.
And they recognize their teams, using tailored incentives, rewards, to keep people motivated and focused on those quality goals.
So it's this blend of strategy, operations, and a real focus on people. Our sources also mention different styles of leadership. What are the main types we should know about here?
Yeah, typically we talk about two main styles, positional and influential.
Okay. Positional is based on the job title.
Exactly. Formal authority.
Yeah.
It's crucial for accountability, top-down decisions, but it works best when it's really grounded in data-driven decision-making.
And influential.
That's built more on trust, respect, inspiration, leading without necessarily relying on the title.
So more about relationships and vision.
Right. Often linked to high emotional intelligence, visionary communication. It's increasingly seen as vital for getting team buy-in, especially when amplified by digital tools that widen their reach.
So positional leaders tell people what to do. Influential leaders inspire them to want to do it. Is that fair?
That's a pretty good way to put it, yeah. And the most effective leaders,
Mhm.
they can probably blend both.
Right. Use the authority when needed, but rely on influence to drive the culture.
Okay, that makes sense. Let's shift focus a bit now to the organization itself, the context. Our sources talk about the learning organization. What's that about in healthcare quality? The learning organization.
Yeah.
Peter Senge's framework. It's a really powerful lens for understanding how healthcare organizations can continuously improve.
Okay.
It basically describes an organization that's constantly learning, adapting, transforming itself based on new information and experiences. Senge identified 5 key disciplines.
5 disciplines. Okay, let's walk through them. What's the first?
First is personal mastery. This is about individuals committing to their own continuous learning, their own growth, pursuing a personal vision, reflecting on their practice.
So lifelong learning at the individual level.
Exactly. Often supported by things like online learning platforms. The second discipline is shared vision.
Aligning everyone.
Yes, aligning individual and team goals with the bigger organizational objectives. This happens through inclusive dialogue, workshops, surveys, communicating the vision compellingly, maybe using storytelling or digital media. Tools like Miro can help with this collaborative vision stuff.
So individual growth fuels a collective purpose. Makes sense. What are the next ones?
Third is mental models. These are those deep-seated assumptions and beliefs we all have that shape how we see things and make decisions.
Challenging assumptions.
Right. A learning organization encourages critically examining these assumptions. Through debriefs, reflection, asking open-ended questions, AI decision support can even help challenge leaders' existing models.
Interesting. And the fourth?
Team learning. This is where the first three disciplines kind of come together.
Okay.
It's about teams collaborating effectively, solving problems, sharing knowledge openly, and critically, having that psychological safety we talked about earlier where diverse views are welcome. Platforms like Emural can support this collaborative problem solving.
So each discipline builds on the others, creates a synergy. What's the final piece?
The fifth discipline is systems thinking.
Seeing the big picture.
Exactly. Understanding how everything is interconnected within the healthcare system. It requires that commitment to learning, willingness to challenge assumptions, including our own biases, and integrating different perspectives for a holistic view.
And tools can help here?
Yeah. Process mining tools can be invaluable for mapping out complex workflows. And it's worth noting, modern learning orgs are increasingly using AI-driven knowledge management systems to capture and share knowledge effectively, speeding up that learning cycle.
It sounds like a really dynamic, adaptive way to run things, constantly evolving. But, change is hard, even with the best intentions. Our sources also talk about change management. What are the key ideas there?
Right. Change management is crucial. Kurt Lowen's classic three-stage model, unfreeze, change, refreeze, is still a useful framework.
Unfreeze, change, refreeze. How does that apply today?
Well, unfreezing could be using compelling data from quality dashboards to show why change is needed urgently.
Creating that burning platform.
Exactly. The change phase might involve piloting new processes using those PDSA cycles, testing and refining. And refreezing is about embedding the successful changes into standard procedures, policies, workflows, training. Digital change management platforms can help track adoption too.
So a structured way to navigate change. What about specific strategies leaders can use to make change less painful, more effective?
Coaching is vital. Using strengths-based approaches, giving regular feedback to help people adapt.
Communication too, I assume.
Oh, absolutely critical. Frequent, transparent communication.
Mm.
Using digital channels effectively to keep everyone informed, manage expectations.
What else?
Actively involving people in decisions builds ownership, providing positive motivation, recognizing early adopters, celebrating wins, offering tailored rewards can drive engagement.
Right.
And promoting teamwork using collaborative tools helps share the load and build synergy during that change period.
Those sound like very practical, people-focused strategies. And how do you make sure the changes actually stick, become the new normal?
Sustainability, yeah.
Yeah.
That's key. Leaders need to continuously monitor outcomes with real-time analytics.
Mhm.
Are people following the new processes?
Yeah.
Where is more support needed?
And reinforcement.
Definitely. Reinforce new behaviors through ongoing training, feedback, maybe tying it into performance evaluations. Change management software can help automate some monitoring. It's really about building new habits.
A continuous cycle.
Mm.
Assess, implement, reinforce. Got it. Okay, one final piece that seems to tie everything together is communication. What's critical here for quality leadership?
Robust communication structures are foundational. You need effective two-way channels, platforms that allow dialogue, feedback.
Not just top-down broadcasting.
No. And it's vital to close the loop. Clear meeting agendas, documented action items, follow-ups for accountability. Tools like Asana can help track this.
Okay.
And ultimately, all communication needs to align with the organization's mission, vision, priorities. Everyone needs to understand the why.
The purpose behind it all. What about different communication styles? Are some better than others for quality?
Well, you see a variety in practice. Top-down is essential for clarity on goals, priorities. Digital dashboards are great for visualizing KPIs here.
And bottom-up.
Equally critical. Getting feedback from frontline staff. Anonymous surveys can encourage candid input.
What else?
In complex projects, you need a matrix style for alignment across teams. Then there's diffusion, the more organic spread of info via newsletters maybe, and spread more person to person for less urgent stuff maybe via social intranets. Each has its place.
So, using the right style for the right message and audience. A strategic approach. What about the actual processes? Meetings, reports, emails?
Well, for oral communication, like meetings, active listening is key. Really understanding, building rapport. Training can help here.
And written.
Still vital. Regular reports create predictable cycles. Automated tools help efficiency. Emails are good for documentation, follow-up, but you need systems to track things.
Paper versus electronic.
Many places use a hybrid approach now. Cloud-based document management is huge for streamlining things and ensuring access.
So being deliberate, choosing the right tools and techniques for the message and the audience, it really highlights how interconnected everything is: planning, regulations, leadership, learning, change, communication.
Precisely. Effective leadership in healthcare quality, it's truly multifaceted. It demands strategic thinking, regulatory know-how, a real commitment to learning and improvement, and just exceptional communication skills.
And data and technology are key enablers now.
Absolutely indispensable enablers for achieving those goals.
This has been incredibly insightful, a real deep dive, and it makes you think about individuals who embody this. Our sources mention Dr. Mazen M. Salama, his background in clinical data science, quality management, cardiology, developing the CPHQ course.
Yeah, he sounds like a prime example.
A real thought leader at that intersection of clinical practice and quality science.
He certainly is. His diverse expertise really highlights that interdisciplinary nature of quality leadership today.
So, as you, our listener, reflect on all this, maybe consider this, how might these principles extend beyond healthcare?
Interesting thought.
Could these core ideas, strategic alignment, a learning culture, effective communication, managing change, apply in other complex fields you know?
It's likely, isn't it? The fundamentals are quite broad.
Right. Maybe think about implementing learning organization ideas in your field, or using data analytics for improvement outside of medicine. It's all about taking these insights.
And seeing where they might spark new ideas, new approaches in your own world.